Welcome to tonight's session, or today's session, or this morning's session on Real Talk, the realities of being and becoming an IBCLC. I am Angela Love-Zaranka, Program Director here at LER.
And hello, I second Angela. I am Sekeita Lewis-Johnson, Accredited Provider Program Director here at LER, and welcome into this space.
So a little bit about Sekeita and I. I am an IBCLC. I started out working in the community over 30 years ago, and I have worked in multiple settings: hospital, private practice, volunteering for organizations to provide expertise and to provide sort of that support and guidance for organizations that are supporting breastfeeding families and those who are providing lactation care to others. How about you, Sekeita?
Yeah, so I am a family nurse practitioner, an IBCLC and birth doula. I've been a nurse for 25 years. I've been a lactation consultant for about 15 years. And I bring you experience from the hospital, from the community, from teaching in, colleges. And so, yeah, I'm happy to be here and happy to share some of the things that I've learned along the way.
Excellent. So let's do a little bit of housekeeping here before we get started. If you'd like to ask some questions, asking questions in the GoToWebinar platform is relatively easy. If you are participating on a desktop, this is where you will find it. Notice the blue arrow in the interface. Now, if you are on a mobile device, take a look at where the green arrow is pointing. It's at the bottom of the app, and you see the question mark there. And that's where you can type in any questions, or you can comment as well, and the organizers will see any comment that you have. So please do feel free to practice with it and let us know. Where are you joining us today? Please type in the province, city, state, country where you are joining us, and we love to hear where folks are listening in. So if you have any questions, we have a couple of fantastic support folks who are here to answer questions that you have. We have Wendy, who is from our customer support team. She is monitoring the chat and the questions panel, and we'll answer some of them, but we'll leave a few for Sekeita and I to answer at the end. Now, there is a member of our tech team, Jill, who's also on the call to help with any tech issues that you may be having. If you're watching this recording on YouTube, please reach out to us at support@lactationtraining.com if you have any further questions. Now let's dive in and take a closer look at what a lactation consultant is and how you can follow your passion and become one. If you do decide to become an IBCLC, you will join more than 35,000 IBCLCs in over 131 countries and territories. Credentialing as a lactation consultant is offered by the International Board Certified Lactation Consultant Commission. Take a look at their website, ibclc-commission.org. They have different regional offices depending on where in the world you reside or work. Review the requirements and pathways to become eligible to take the IBCLC certification exam. Well, what do you need to know? There's something called a detailed content outline or exam blueprint. It's based on surveys of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and chronological stages an IBCLC needs to know in their work. LER courses cover the entire detailed content outline, and our courses are approved by LARC. That's the organization that evaluates and approves lactation consultant training courses, and LARC stands for the Lactation Education, Accreditation, and Approval Review Committee. Now, Sekeita is going to review a few questions to ask yourself today before you get started. Sekeita?
Yes, thank you so much, Angela. So before we start to take a deeper dive into today's subject, it might be helpful if you wrote these questions down. And when we're talking about skills, so the first question is, do I have these skills, right? And sometimes we often think about skills as actually the hands-on, the tangible, the touchable things. But as you will see, I'm talking about that, and I'm also talking about a whole host of other things. And so it's important to kind of reflect, think about the things that are being said. But you're in the right spot. So if you don't have these skills, you want to start thinking about, where will I obtain these skills? And so just be cognizant. We're going to go over a lot of things. And so luckily, this will be recorded so that you may have time to re-look at it and redigest some of the things that we're going to talk about. So let's talk about what makes an IBCLC. Competency is the top of the list for me. And I'm sure it's probably the top of the list for you if you've ever come in contact with receiving services of any kind. So competency is critical. It's really necessary to make sure that you are providing the adequate and appropriate and skilled lactation support. So it's having the ability, the knowledge, and the skills. So, when we think about sometimes where we're at in this stage, we come into this profession as novices, right? And that's okay, because that means you haven't touched everything, you haven't saw everything. And then as you start to get tools under your tool belt, a little bit more resources, you become more confident in your competency, you become more confident in your ability to really critically think through complex lactation situations and be able to provide care that's appropriate for that level of acuity. So by the end of your training, you want to just be confident that you are competent, which means that you're doing no harm. And that is the crux of what competency really signifies. All right, culturally appropriate and credible. If you've worked in any or heard any other healthcare people speak about cultural and what cultural is, I know when I went to nursing school, it was all about cultural competency. And so for this sake, I really talk about being culturally appropriate as well as being credible. So let's unpack what I think it should resonate, or, just some thoughts about culturally appropriateness. So, wow, competency. When you think about competency and you think about, competency, it's mastering skills and knowledge. And sometimes while we can be culturally relevant or provide culturally appropriate care, it's hard to master someone else's culture or to become such like an expert, like we're an expert inside of someone else's culture. So other words that you might hear is cultural humility, which is really just, taking a look at our own selves, our reflecting of who we are, our value system, and really not projecting it on to other people. So culturally appropriate is more fitting for where we want to be, and that truly starts with cultural humility. And so, with that being said, it's so important that we go into situations with families and we avoid saying things like, oh, they don't do this or they don't do that. Because they don't do that in their culture. Believe it or not, we still hear things like that. We want to avoid saying things like that, because it feeds into stereotypes. And we really want to not make assumptions about what people will or won't do just based on their culture. It's important to know the individual and be told by that individual what their needs are. And so that will usually translate, if you practice in this way, into becoming more of a credible practitioner or credible lactation supporter. So ask yourself, like when you get asked a question and you don't know the answer, how do you typically respond? I know some people try to just answer off a whim. They just try to go off their lived experience, particularly in lactation. There's been examples where someone asks someone a question they didn't know, and they'll say, well, when I did it, or so you want to be careful and start, what does the evidence say about that? And keep in mind, We're not all walking dictionaries. And so it's important that if you don't know something, you really want to, dig in and say, you know what, let me get back to you. I don't have an answer now, but let me check on that. And that's how you become a credible resource. You become credible that you are given information that A, coincides with the best evidence, and B, that you really know what you're talking about. So the question becomes, well, what does the evidence say? And do you know where to go find the evidence? You know what? And then I do want to say this about credibility. When you answer questions as a lactation supporter without a firm basis and without a firm knowledge of knowing how to answer a question, when you lose credibility, it really translates to other IBCLCs in the community losing credibility. So credibility is everything, and just really be mindful of really, as an IBCLC, you want to make sure that it's not, your answers are not causing harm to the profession. All right. Policy advisor and creator. So a couple things about what we do with policies. IBCLCs, we advise on policies, we actually write policies, but also we inform policies and shape policies by really knowing what policies impact us directly and indirectly. So if you work in policy already and you have a firm handle of policy making, then that's one skill that we welcome and say, hurry, 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 right? But even if you don't have a background in policy, you are a stakeholder. And so that means that you are sitting at the table, whenever specifically there are lactation specific or related policies being discussed. So, maybe it's not your strong suit, but as an IBCLC, trust me, you really want to know how policies are created and how they impact us, because then that informs your advocacy. And advocacy is such a huge part of who we are as IBCLCs. It's a big part of what we do. And an advocate is just somebody who simply publicly supports or recommends a particular cause or policy. So even if you're not a policy advisor, so to speak, you can be that person at the table listening to how policies are created. Problem solver and researcher. And these two, to me, go hand in hand. Being a problem solver is about 90% of what we do, because each and every family has their own concerns. And when we're talking about lactation consultants, usually we're called for a concern. We're called because there is some type of problem or issue that a family is having with breastfeeding or chest feeding or even lactation and pumping milk. So be mindful about framing lactation concerns from this one size fits all frame. We know that one size never fits all, and so we really have to dive into problem solving from this individualized lens of what the particular family is asking you for, or what concerns are they sharing with you. So along with being that problem solver, remember, sometimes you have to look back and say, you know what, I don't know this, right? I don't know this, and you have to look it up. Well, that's being a researcher. In IBCLCs, we're researchers in two different ways. Some of us are researchers where we actually do scientific studies and all of the scientific research, the methodology, the frameworks, all of those things. And then other of us are researchers because, like I said, we're not walking around with like dictionaries with everything in our head. We have to really use and have valid and reliable tools that inform our practice. High-level lactation care. Woo, I love this one. I love the skill. I actually now, because it's been so many years, I really do love high-level lactation care because it breaks up the monotony. So what am I talking about? When I talk about high-level lactation care, really it's the spectrum of non-complex, common concerns that are encountered, all the way to the sometimes unseen, whoa, what is this? Let me figure this out. So let me give you an example or provide an example. Someone that's high level may be a person that's in the ICU, that's really intubated, that maybe and when I say that, I mean on life support, that really has, a lot of things going on. Maybe there's something going on with their brain. Maybe there's something going on with their heart. Are you able to really, and this person said, I definitely want to provide milk to my baby prior to this, or they were already providing milk to their baby. So with that being said, are you able to deliver that type of care? Are you able to look at the medications and say, okay, well, so this person is intubated, they may have a brain injury. How does that brain injury impact lactation, or does it? Are you able to make the connections? So when you're going through your training and you're like, oh my goodness, why do I need to learn about the brain? And why do I need to learn about these cranial nerves? Well, it's all connected. And so, yes, you do need to learn about the brain, because it is that level of care that sets IBCLCs apart. Being able to handle these complex clinical cases with sound clinical decision-making and recommendations that are appropriate for higher acuity levels. So that is the skill level that's necessary for optimal health outcomes and to make sure that we are meeting the needs of families, from the common all the way to the most complicated. Essential and timely. So one of the things that we found out, particularly during the pandemic, was that essential was more like, buzzing around, and it became a buzzword. And we found out, some of us that were still entrenched in the work, doing this work, that yes, lactation consultants are essential. Because during that time, babies were still being born, babies still needed to eat, parents still needed assistance, especially during an emergency, and we were in dire emergencies. So during emergency times, it's essential that we know we have to promote and protect the ability to provide human milk, and how critically it is important to food security for our little ones. So not just, thinking about, yes, breastfeeding and chest feeding is for bonding, and it's, but, you can feed other ways. Absolutely. But from a public health standpoint, public health and prevention standpoint, it becomes critical along with food security. So yes, we are essential, and it's important that we continue to show up when we're needed, that we are timely, that, we become an IBCLC and it's all of a sudden like, nope, I can't help you. Well, it's important that we know we are frontline workers. And I just really want to be really clear and real about that. I mean, during the pandemic, we talked a lot about telehealth. The reality is, in certain rural areas and other areas alike, the bandwidth did not support telehealth for some families. And in rural areas, there are disparities similar to urban areas. And so really, I love telehealth for a lot of reasons, but sometimes it does prohibit us from using our other abilities to be able to assess a situation. And so it's what I'm really trying to impart is that we are essential, and it's really prudent in our duty to show up so that we minimize harms that are caused to families, that we are accessible, because that is truly what becoming an IBCLC is all about. Collaborative care partner, becoming a trusted, oh, something happened and the words switched around a little bit, a trusted collaborative care partner, but that's all right. So I love this phrase so much because it assumes that you are collaborating with your client. It assumes that you're not the center, you're not the decision maker, you are simply collaborating. You have to keep at the forefront of your mind all of the time that it's the family and the partners concerns, it's their fears, their goals, it's the barriers for them that takes precedence over your goals for them. So what am I saying? So we all know the recommendations for exclusive breastfeeding is for at least 6 months, and we know that, right? And it's important that we still honor and we still talk about that, we still educate about that. However, we also have to understand that we are collaborating in partnership, in agreement, and that when someone seeks our care, that we make sure we approach it in a manner that we do not overstep boundaries that are not meant for us to overstep. And that's how you become trusted. In all honesty, you become trusted to do no harm, to be reliable, trusted to say, I see you as a person. I see you and we're in this together. I'm not higher than you. We're collaborating to do what is best for you. And that is truly how you become trusted. So when you go into clinical situations and you assume a hierarchy, you go in like, yep, I'm an expert or I'm the expert. I know all about this. I've been teaching this for about 10 to 15 years. I'm going to tell you how it should work. Trust me, no doubt. Da, da, da. And you just start going in and touching without permission. Or someone, say they wanted to latch, and you assume that the latch assistance they needed is that they needed you to physically take their baby and physically handle their tissue, their breast tissue. That's not collaboration. And so really and truly thinking about, you are there to collaborate with the family and deliver person-centered care. And so what we're talking about when we talk about person-centered care, excuse me, I had to clear my throat. Person-centered care is providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that all patient values guide all clinical decisions. And so if you will notice, and this actually definition is from the Institute of Medicine, but if you think about all the things that I've said, I've talked about culture, I've talked about care, communication, and collaboration, and the person is the center of it all. And this is really what the practice model should be in action, not just in word. I just mentioned buzzwords, and sometimes in healthcare, we get these words and we say, oh yeah, I'm delivering person-centered care. And sometimes from what I can see, that's not person-centered care at all. And I can say that on being on the receiving end of care, right? And so don't let this become a buzzword with you. Truly be intentional about building your skill set so that when you are communicating and providing care and collaborating, that you are being culturally appropriate. Okay, so I began with 2 questions, and now before Angela takes over, I'm going to end with 3 questions. I really hope you take some time and write these questions down, because I really think that they are important for some things to think about. So before you start your journey, or even if you are already on your journey, think about what are your current commitments, your job, your school. What does lactation support look like in your area, in your local market? Who's providing support? Is the area saturated? No, it's not, because Angela already went over the numbers. So it's not, but we need lactation consultants. We need IBCLCs. Also think about, how does this fit my lifestyle? There's clinical hours that are going to be necessary. And so you really want to take some time out and really reflect on your journey and kind of organize it so that you can minimize some of the barriers that, I could have foreseen this, if I had properly planned it out. And so best wishes to you on your journey. And I'm going to pass it over to Angela.
Sekeita, that's so valuable. Thank you so much for going through all that, the questions, as well as what an IBCLC does. It just is so important. Okay, so the roadmap to becoming an IBCLC, it may feel a little bit complicated, but I'm going to break it down and give you a roadmap. We're going to touch base on this later in today's presentation, but as you listen, know that you don't have to go out and find each one of these things. LER has ways to help you with each step of the process. First, you're going to choose a pathway. We're going to come back to that in just a minute. Each pathway has 3 components. There's education, clinical hours, and getting ready for the exam. As I said, we've got you covered on all aspects. So first, health sciences. There are two different types of education that you need, and the first one is health sciences. This is the typical education for healthcare providers. There are 8 post-secondary or university level courses and 6 general education subjects. You can find a full list for each of the 14 subjects on the IBCLC Commission's website. You can search for it, or you can find it in the link in your resource document. If you go to the GoToWebinar interface, it's right next to the question box. It should say handouts. Now, the 8 university level courses are, and you don't need to write these down now, they're biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally, sociology or cultural sensitivity or cultural anthropology. They can be online or in person, as long as the institution is accredited to provide the learning. If you took any of these courses during your college career, they count, even if it was 20 years ago. LER partners with Walden University to provide these basic college courses. Walden is online and they have chosen the courses to best fit the Commission's requirements. Walden also has special pricing for LER students. You can go to our website and find out more information about it. We're really excited about this program that Walden is partnering with us in order to reduce one of the barriers to becoming an IBCLC. Now, the 6 general education subjects are medical documentation, medical terminology, occupation safety and security for health professionals, professional ethics for health professionals, universal safety precautions, and infection control and basic life support. Now, 5 of the 6 general ed courses can be taken through LER. The only one you're going to need to search for is basic life support. In many countries, there is an in-person skills check for this training. Now, I have heard of some organizations providing this training completely online. Check with your local resources. The guide provides general descriptions for the typical courses in this subject area. If you go to the Commission's website, you'll find that guide. Please keep in mind that the IBCLC is an international credential. The names used in their document to describe the courses may not exactly fit the description of the course at your accredited education institution. It's okay. You will note broad terms with the understanding that there is no one universal description for what a course in, let's say, clinical research should cover. Now, why are these 14 courses required? The IBCLC is a standalone credential, meaning you do not need another certification, degree, or license to practice as an IBCLC. Once you pass the exam, you'll be an allied healthcare professional. The courses will help you to be prepared for your career, as well as help you to pass the IBCLC exam. Now, the second thing is lactation-specific education. Again, we've got you covered. The education should be comprehensive and cover the detailed content outline. The Commission requires at least 90 hours of lactation education, 5 hours on communication skills. Now, our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. Now, the third component is lactation-specific experience. This can be in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding and chest feeding families. It also includes lactation assistance to pregnant and breastfeeding clients and lactation education to families and/or professionals. These hours need to be obtained within the 5 years immediately prior to applying for the exam. How many do you need? Well, that depends on your pathway. Pathway 1 is for health professionals and those who provide breastfeeding support through an IBLCE recognized breastfeeding support counselor organization. Healthcare professionals include, according to IBCLC, physicians, nurses, midwives, dietitians, physical therapists or physiotherapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as Lactation Education Resources, La Leche League International, and the Australian Breastfeeding Association. Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both didactic and clinical components, and they require 300 clinical supervised hours working with breastfeeding families. Pathway 3 is a structured mentorship program between an IBCLC and the applicant. The IBCLC, or if there are several, must all be in good standing with IBLCE. Those who choose this pathway must have their program pre-approved by IBLCE prior to beginning their clinical hours. Now, a quick note, for those of you who have either breastfed or chest fed or provided human milk for your child, the hours you spent nursing, pumping, and helping your friends sadly doesn't count towards your clinical hours. Now, while the 500 or 1,000 hours seems like a lot, there's a really good reason why. Each candidate needs to have the clinical experience so they can provide competent care as an IBCLC. If it's any consolation, the number of hours used to be a lot more. I've known IBCLCs who needed more than 2,500 to 8,000 clinical hours to sit the IBLCE exam. So the two different pathways, Pathway 1 and Pathway 3, are the ones we're going to focus on now. So candidates who are applying for the exam through Pathway 1 need 1,000 clinical hours. For the candidate who is also a healthcare provider, those hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBLCE recognized organization, their hours must be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. The hours need to be counted on an hour-by-hour basis. Now, 2 important points about these clinical hours for Pathway 1. It's important to document the hours as you accrue them. Be very detailed in case IBLCE chooses to audit your application to take the exam. They may want to see documentation such as a spreadsheet or some other document where you counted your hours. And the second important point about clinical hours is that these hours, these 1,000 hours, do not need to be directly supervised. Now note that LER has a program for those of you who are not already affiliated with a breastfeeding support organization. Our hours program offers you a way to gather those 1,000 hours in your community as a certified breastfeeding specialist. Now, Pathway 3 requires 500 hours of clinical experience. It's best done in a busy practice setting where you can work with many breastfeeding and chest feeding people and those providing human milk for their babies each day, such as a hospital or clinic setting. The hours count towards the 500 when you're actually working with the families. Observation hours don't count. Remember that clinical experience is graduated. That is, it starts with observation and then doing a few tasks under supervision, then completing those tasks independently with the IBCLC nearby to ask questions and discuss situations. LER has an internship program with many sites around the United States. Reach out to support@lactationtraining.com and we can connect you with our clinical internship director, Amy, to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate an internship site. Now, one thing Amy did want me to mention during this webinar is that you can't start to count those hours towards the internship requirement until both you and the IBCLC are comfortable with you working independently. Most interns spend approximately 75 hours in orientation before you can begin to accrue the 500 hours. Or you can take a look in your community to see if you can find a willing internship site or mentors. You may need to reach out to several people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk to others who've been through this pathway to find successful strategies with finding a good mentor. Learning from an experienced clinician is worth the extra effort involved at the beginning of this pathway. Now, as far as clinical hours, a lot of people are asking whether or not they can accrue those hours via telehealth. Now, the quick answer is yes. The longer answer is paraphrased from IBCLC documents. IBCLC will allow the use of technology if certain parameters are met. You'll need to pay special attention to the privacy rules, the Code of Professional Conduct, and clinical competencies for IBCLCs. This guidance has been extended until 30 September of 2024. Make sure that you stay up to date with whether or not you can accrue hours with telehealth during this time. Now, education, the lactation-specific education. We have two ways that you can gather those hours. One is the Lactation Consultant Training Program, which is the full 95 hours front to back. The other is either core or bridge. They're designed to meet your education needs depending on your background and previous lactation education. Now first, our 95-hour Lactation Consultant Training Program. This course is eligible for CERPS, CME, and nursing contact hours. It's intended for those who do not have any lactation education and know they want to be an IBCLC. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices, such as your computer, tablet, or phone. They are optimized for a computer, but they can be reviewed later when you're on the go. We've been conducting in-person and online education since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we'll update sooner as new evidence emerges. Have a question for the instructor? You can send an email to our support forum, and we have IBCLCs on staff available to answer your questions. You want to discuss a concept with your fellow students? We're discussing innovative ways for people to connect. Stay tuned for more information. Now, on the completion of the 95-hour course, you are eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you are a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With this certification as a CBS, you can begin to collect your clinical hours through our hours program to take the IBCLC exam. Now, if you're unsure where to start, or you already have some lactation-specific education hours, then we have our core or bridge programs to meet your needs. They have the same advantages as the LCTP course. Now, our initial course is called Core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's 52+ hours of online education. It covers the basics, such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is the Certified Breastfeeding Specialist exam. Our bridge course is ideal for people who have the basic lactation education and they need that additional 45 hours to qualify for the IBCLC exam. Topics in our bridge course include legal and ethical issues for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. If you're not sure where to start, well, if you're new to the profession, I would suggest the core course. Get your feet wet first and see if becoming an IBCLC fits your needs. Now, I know that these requirements can seem like a lot, but we're here to help you every step of the way. If you have questions about the pathways that don't get answered here today, be sure to reach out to our friendly customer support department. Many of our team are IBCLCs and they know the process inside and out. LER has 3 ways for you to earn your education, depending on your goals, where you are right now in the process. If you have questions about what would be right for you, again, our customer support team is here to help. If you're not a healthcare professional working directly with mothers and babies, getting those hours can feel like a challenge. We have 2 programs, one for Pathway 1 and one for Pathway 3 students. And when you're ready to sit the exam, we've got you covered there too. We offer 2 versions of our very popular exam prep. Both use LER QBank, which is a comprehensive system including practice exams, photo flashcards, anatomy flashcards, study schedules, and many more products to support your journey. For those of you who take our 95-hour course, we include a discount to our exam prep course as well. Now, our 90-hour course, as well as the core and bridge courses, are available in Spanish. Capacitación en Lactancia is our website, which provides the same high-quality education found on LER in Spanish. Now, for all of our products, either the Capacitación en Lactancia courses or the ones found on lactation education resources, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of our commitment to increasing access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. In our alignment with our continued commitment to diversity, Lactation Education Resources is proud to announce our Rising Tide Lactation Equity Scholarship Program, designed to increase the number of Black and Latinx and Hispanic IBCLCs in the United States. We recognize one of the greatest obstacles to entry into the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for Rising Tide Scholarship awardees. We alternate these scholarships each year. 2024, we will host our Rising Tide Scholarship. You can find out more information on our website, lactationtraining.com/Rising Tide. Our team is here to help you now and in the future. Tech support is open 7 days a week. We even answer our phone during regular business hours on the East Coast of the United States. Get your questions answered about the content by those experts in the field, and we can provide you with ongoing support for the next steps in your career. Last week, for example, someone reached out to one of our instructors with a question from their own practice. We made the connection and the former student received the answer to help their client. Another student had a question about creating a policy, the advocacy that Sekeita spoke about, and they were creating this policy at their hospital. We found the appropriate instructor to answer the questions and to provide additional resources. We're here for you. Thanks so much for your time today. Now, what questions do you have for us? Sekeita, did you find anything there?
I did. So there's a question that I absolutely love. And here it is. Is it possible to obtain a job in which we are paid while simultaneously working on obtaining our hours? That is like a dream job, right? Angela, what do you say?
I say yes, there are, but it really depends upon your region, your area, and what resources you have available. I do know of a couple. There are other requirements that these organizations have. So again, that homework that Sekeita so beautifully discussed earlier and asking those questions is something which is important for the different communities, for the different organizations in your area.
Yeah, absolutely. Thank you, Angela. Here's another question. So just to verify, I need 1,000 hours completed before I can register for the exam, or do I register when I think I'm close? Well, you should have it completed before you register to sit for the exam. Sometimes, you know, Angela, did you mention about being audited? I'm not sure if you went through that level, but you know,
I briefly did, but go ahead, Sekeita.
yeah, so it's important that when you're ready for the exam that you have really solidified that you are ready, which means you have met the criteria for whichever pathway you're going to take. So if it's the 1,000 hours, 1,000 hours. If you're in a Pathway 2 program, it's the 300, right? And if it's Pathway 3, that means you have this mentorship relationship and it's 500 hours. Because essentially, even with the Pathway 3, you are really requesting to do the Pathway 3. And so
Right.
the IBCLC that you link up with and mentor, they're signing their name on the line, backing you up for these 500 hours. And so just to keep fidelity to really what it entails, yes, they should be completed.
Yes, they should. Before you, and that's another question. Some people will ask if they need to do their training before they do those hours. And it is something which is important. Our Pathway 3 internship director does require the 95 hours to be done to ensure that you're providing that evidence-informed information. So
Absolutely.
Sekeita, I see a question, may I?
Go ahead.
That actually Wendy answered, but I think I want to really amplify this a little bit more. So this person is a certified breastfeeding specialist. They've completed our, 95-hour training, and they say 100 hours, and you're right, that version of our course was 100 hours of training. And they would like to accumulate the required 1,000 hours by working independently or volunteering with a medical practice. And they're wondering if, as a CBS, you can do that. Yes, you can. As a CBS, our hours program is here for you. There is a separate application for it. And I highly recommend that you take a look at it and see. We really would love to have you join us. And, some people will say, I referenced, if you've got a question, you can reach out to us. Sekeita's an IBCLC, I'm an IBCLC, Amy's an IBCLC, Julie's an IBCLC, Kim's an IBCLC. We have a bunch of folks at LER who can answer any of those questions that you have and to provide you with feedback. Let's say before you do a prenatal breastfeeding class and you want someone to sort of take a look at your curriculum, right? Or to give you a few suggestions. We're here for you. And so that's something that we can do. So thanks, Sekeita, for allowing me to pop that one in.
No, if you have any more, please feel free to jump on in. There's a question, and I like this question because I think there's some people don't know, and it says, can you use financial aid like for college for these courses? And
Hmm.
you can use financial aid for your health sciences courses. If it's at a university, absolutely, you can use financial aid. As it relates to any of the SERPs or lactation education, unfortunately, no, but for college courses, absolutely.
Well, and about that, that's one of the reasons why we have this partnership with Walden. And I just want to, highlight that a bit. The relationship with Walden is they understood, they saw how few people from certain communities are not represented as IBCLCs around the world. And they actually worked with us in order to remove one of the barriers. Unless you were going for a degree program, I think you had a challenge with getting the financial aid. And so what they did with those 8 courses that are required is they provided special pricing. And the pricing is for all 8 courses, $1,750 through Walden as an LER student. Absolutely phenomenal. You can't even do one course for that price. It's online, it's self-paced, and we have worked with them in order to find the courses and make sure that they're a good fit. So, I mean, really, what Walden has done to remove one more barrier is something that's just absolutely phenomenal. So and if you can't take all 8 at the same time, if that's a barrier, each individual course is $250. So you can, that's one thing that you can do. At least it makes it a little bit more palatable. And for that price point, some people can say yes. So thanks.
Oh, I got goosebumps when you said that because that is huge.
It is.
That is huge.
Mhm.
One class, a college course, even if you broke it down. Anyways, I won't belabor that. But next question, when becoming an IBCLC, is there specific liability or insurance to consider when entering private practice? And I would say absolutely yes. Yes.
Absolutely, yes, yes.
Mm-hmm. If you're going to be of any type of service, any type of private practice or business, it's very important that you protect yourself. You work so hard to get the credential and to get, all these clinical hours. I mean, this is not
Yes,
an easy by any means. It's just not like, oh, walking to the store or, suckling a lollipop. No, you have to put in tons of hours, tons of work. I'm serious, Angela. And
I
so
know. I
we're
agree.
in a litigious, unfortunately, society, and
Hmm.
you just want to make sure that you're covered. And so, absolutely.
In the United States, especially.
Yeah.
Those who are in other parts of the world, y'all aren't nearly as litigious as, we can be here in the US. So that's true. Um, and for the person who put in several comments saying that they've reached out to many IBCLCs in their community and they just can't find anybody, they said, and I quote, they are getting crickets. If you're a certified breastfeeding specialist, then I know that some people will say, well, that's double the amount of hours. And if though that is able to remove a barrier, if you are able to begin supporting families in your community, yes, finding a mentor is always something that, we all want someone to hold our hand as we're trying something which is new. And, CBSs are provided with that basic lactation education. And so let's have a conversation about it. Let's talk about it and see if the hours program would be a good fit for your community.
Yeah. Angela, thank you. One of the things about finding mentorship, and I agree with that, I just want to add to that, is that there are different avenues to find mentorship. And so sometimes we're looking, for example, if you have like local, either the Leche programs or local coalitions, have you integrated?
Coalitions, yes.
Have you
Hmm.
built relationship with people? To be honest, and I'm going to say this because we're talking real talk, right? I want someone who's serious. I want someone who understands that, yep, I'm taking time to teach. And so there is a relationship of trust that needs to be built, right?
Hmm.
There are some strange things that have occurred. And so, yeah, if, you know, integrate yourself, immerse yourself around folks that would be able to really build relationship with you and then give you some direction. And I think sometimes, because it's such a fast-paced world, we're like running. We just want to, you know. So it's sometimes a slow process, is what I'm saying. But keep trying because it is not impossible. I just want to say that. If
It
you
is
are
not
persistent,
impossible.
it is not
Yep.
impossible to find a mentor.
Yes.
Moving to this next question, this is a huge one, Angela. It says, one of my biggest concerns about pursuing the pathway one clinical hours option, is that I will miss the opportunity to learn from the experience and skills of experienced IBCLCs in varied settings. It sounds like the hours program seeks to fill that gap. What does this look like, practically speaking? How can the hours applicant make the most of the experience available to them? Very thoughtful, well-written question. Angela, you got it?
I do. The thing is to learn from the experience and skills of IBCLCs in a variety of settings, that is, how does this look practically? Well, it's a matter of starting to support folks, doing all the questions that Sekeita talked about, finding out where there are gaps in your community and find out where you feel comfortable sort of like filling in that gap. And for example, let's say that you discover that there are, obstetric practices, either midwifery, or there are obstetricians who are, delivering babies in your community, and there are no prenatal breastfeeding classes. That would be something that you would do. Let's say you've never taught a prenatal breastfeeding class, and we do have a course on teaching classes. And let's say you've never done it though, and you want someone to take a look at it. Well, then just reach out to us. We can take a look at it. The IBCLCs on staff, the CBSs, the La Leche League leader, we can take a look at it and give you some, background. I mean, really, you've got the vast experience as Sekeita. You said you've been doing this for like 25 years, right? I've been doing this for over 30 years. Then we've got Julie, we've got Kim, we've got all of us here who have got, a lot of years of experience, and we've all worked in different practice settings, right? Sekeita's worked in facilities in a large hospital in a large city. I've worked in military medicine. We have folks, Amy used to work in the NICU. She set up the NICU program there. I set up the lactation program at my hospital. You know, we've done these different things, but we've also run support groups. We've done education. You're a doula, Sekeita, as well. So, I mean, you've got that skill set that you bring in and that you can really relate to folks who are birth workers and how to offer that sort of lactation support, right?
Absolutely, Angela. Thank you. I don't usually don't leave that out, but apparently I did because I don't remember saying that. Absolutely. I think yes to everything you said. Yes. Whew, I love
Excellent.
these questions and I just love it. I feel like we're having a discussion. All right. So this
I know,
other
me too.
question is it wise to finish all the education courses before beginning the breastfeeding courses? That way, once you are done with your breastfeeding coursework, you can jump straight into hours and prepping for the big test. And for me, I think chronologically speaking, that is the best thing. You know, when you are taking lactation courses, sometimes there are topics that come up that you may be like the fourth intercostal cranial what nerve, or you really want to have a solid background into the sciences, terminology that is used before really diving into lactation specific education. It will just make sense. The chronological flow, will help you along the way so that you're not like, wait, what? I gotta go, okay, now I gotta go back and redo these classes because now I think it'll make sense. No, best thing
Right.
is to do those classes.
Yes, 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 it is. And you know, this one person who is asking some of these questions says, I'm looking to specifically work with twin families. I mean, Sekeita, I know I could use a really good a person comfortable with multiples in my community. How about you? I
Yes.
mean, I do it, but I would love to have, oh, look, this person has started a group 14 years ago about twins.
Yeah.
Oh my goodness, please. Yes, yes, yes. Please become a CBS. Please join our hours program. And that would be absolutely phenomenal to have your voice to support not only those families that you're serving already, but then also, I mean, frankly, if I know that you're working with multiples, I may say, could you help this CBS over here? So that would be great.
Yeah. Thanks,
Good.
Angela. Next question. My question is, what material is on the test? Is the test on? Because both the 95 and 52-hour gives you the same CBS credentials, but obviously the 94 hours covers more material.
It
So,
does.
yeah.
Yes.
Go ahead, Angela.
So the 95 hours is really to help folks who want to become that IBCLC and they know they want to do it from the get-go. The 52-hour course is so that people can kind of get started with it. There could be a lot of different reasons why someone would prefer the 54-hour course over the 95-hour course, variety of reasons. And so yes, both do confer the CBS, a certified breastfeeding specialist. Both do allow you to support the normal course of breastfeeding. And so both of them will give you that access to starting your clinical hours. I want to say also about both of those and supporting, just flew out of my head. Off it went. Okay, so never mind. But yes, you do. Oh, I know. The exam is included. So if you take the 95 hours or the 52-hour course, 54-hour course to get the CBS, the exam is part of it. So that's another way to, again, reduce one of those barriers to supporting families.
Yeah. So, okay, looks like there's another question. If I'm taking the CBS 52-hour course, because I have my CLC for 4+ years, but by the time I sit for my exam, my first 40 hours will be expired. Do I need to take the 95 hours instead? Yes.
Yes, you can break
You
it
know,
up
you
though.
hate
You
when
could,
that happens when your hours expire. For those of us have to recertify, we're sometimes in that same pickle, and so unfortunately, yes.
you do, and that's the thing is that it's the 5 years preceding the applying for the exam that you need those lactation education hours. So you could take, the 52-hour course, kind of get going and everything else, and then, sort of like save up the resources and then do the bridge course. So, I mean, you could do both, but as long as you get that CBS, then that's something which you need first.
Yeah,
And
so along with that, can I upgrade what I have registered and paid for already?
reach out reach out to us at support@lactationtraining.com. And Wendy is here. Chances are Wendy's going to get your email. So happy to have it. So let's see here.
And
Oh, to the person who got cut off and didn't hear our answer, we have recorded this. So don't fret. You are welcome to listen to the recording a little bit later. So please, yes.
And Angela, this person is seeking a little bit of clarification on what you were talking about earlier. So I'll just read it. Did I hear correctly? The connecting class finishing the 95 plus hours for IBCLC, the exam is included through LER?
No, the
Uh,
exam for the CBS is included. Super important point. Thank
yeah,
you for that clarifying question. CBS is included, not IBCLC. That's a whole separate organization and a whole separate exam, and it's a thing. So, yes.
absolutely. I might kick myself for what I'm about to say right now, but
What?
this is a very lively group. These
I
questions
know. This
and
is
this
phenomenal.
experience that I'm seeing, like, you know, here where we are in the US, it is 8 o'clock at night. And we usually do these earlier in the day, and our groups are not as lively like this. And so I'll just earlier in the day, I don't know what's happening, but I'm just saying that this is kind of refreshing, like really and truly. So thank you for your questions,
Thank
because
you. Yes.
some of them actually helped clarify some things for me. Even as Angela was talking, I was like, "Whoa, oh, okay." So thank you.
Yes, our hours program is something which is new, as well as our Walden, this partnership with Walden. Both of them are brand new for, 2023, 2024, because we're working hard to reduce the barriers to becoming an IBCLC. So please do consider becoming an IBCLC. We need you to join our ranks. We need your voice. We really need your voice in every single community. From, the reason why we had it at this time of day for the East Coast is to reach out to those folks who are in the Asia Pacific region. And so thank you for joining us today. We really do appreciate your presence. And there's one last question. To confirm, the education hours such as anatomy, physiology do not have to be within the 5 years prior. That is correct. Only the lactation specific education. That's it. So thank you all very much. Anything else, Sekeita?
No, I think that was it. Again, thank you for your time and attention and for all of your questions. We do this live just so that we can field your questions personally. And I love it. I love that you all brought it tonight. So
Yes,
um,
yes.
good luck and best wishes on your journey. Please reflect on those questions, think about it, write your goals out, and we look forward to seeing you. Like, hey, come back and tell us, I took this course, Real Realities, and now I'm an IBCLC. We love to hear those
We'd
things.
love to hear that. Yes,
You
we'd love
know,
to meet you at a conference. We'd love to, we'd love to see you. So please do reach out. So thank you so much. We're excited to have you join.
absolutely. Enjoy your day, night, or evening, or wherever you are in the world. Have a good one. Bye bye.
Thanks, everyone. Bye-bye.